now going to introduce Dr. Arnav Spencer, who is the director of the design lab for the Center for Health. And he's going to introduce his panelists who are going to tell us, does this thing actually work? Take it away, Dr. Arnav Spencer.
Thank you so much, Nicole. Thank you, everyone, for making this possible, for putting your time and heart into this, to Marty for inspiring us. We'll follow a little bit of a different format for our panel. I want to recognize the team effort behind the UC Health's approach and collaboration with the state. And what I'll tell you today is about the work that our team has done, both in the design and in understanding the data. And then we'll follow up with an outsider's perspective, the CDC's perspective on how this all works and how we might learn more. If you go to the next slide, I just want to call out a few things. From the start, we knew we had to design for impact. We knew we had to design for inclusion. We also knew we had, with the limited amount of data we were gathering, to use the most of that we could. So again, I want to thank the team that was multidisciplinary, crossing states, crossing even countries, and many people who put their heart into this to make this work for California. On the next slide, just some further recognition of where we are today, which is that what are now oftentimes called digital proximity notification or digital contact tracing, and then specifically this exposure notification system from Google, Apple, have really spread around the globe. We have over 70 countries who've adopted some form of this, likely hundreds of millions of people who've adopted this within them. And in the United States, we have almost 30 states who've adopted an EN solution. And just reiterating, this really is a new tool in our public health toolkit. And in the context of California, where we weren't the first, we've been able to learn from really wonderful groups from England and Christoph Fraser, who's worth calling out, from our what started as the 5 Western states and is now the Digital Notification Alliance, have been especially helpful, but also groups at the New York COVID Alert, the Digital Design Lab, and Healthcare Human Factors have really supported this team. On our next slide, I want to reground this with something that our chancellor brought up, which is that the University of California, San Diego itself has had an opportunity to be a mini public health system led by our chancellor and Dr. Schooley. We took what we call the Swiss cheese approach, which is a recognition that there's not one silver bullet in public health, but many layers that if you look at them like Swiss cheese, if you get it so the holes don't line up, the virus doesn't go through and the pandemic goes away. So these tools are screening if you're at risk, they're quarantining if you might have had the virus but don't know yet, they're isolating if you test positive, wearing a face mask and getting vaccinated, but also now we have this exposure notification in our toolkit. So just to ground us, I'm going to quickly remind the audience how this works, and then I'll turn it over to our team to kind of dig in. On our next slide, this is how it protects. There's some keys. We have people in our daily life who we interact with. Now that CA notifies around, some of those will have adopted. In this picture there in the dark blue, and the lighter color are those who haven't adopted. You'll interact with people during your day, and therefore some will have had CA notify and others will not. On the next slide, let's say a user tests positive. That person went and got tested. As you've heard, they're going to receive the results. And now we really need them to enter those results into CA Notify. So what happens if they do? Next slide. So people who've been in contact or proximity with the person who initially tested positive, whether they actually know that they were in contact with that person or not, will receive an exposure notification. Next slide. So let's ground this a little bit with Alexa's story above. Imagine that you don't know anybody who has COVID, and it's a Sunday, and maybe you have a little bit of a scratchy throat and the weather's changing. And ordinarily you'd think it was just that scratchy throat. Maybe you'd take your kids to the park, maybe you'd go visit your family. But on this day, you got tested, and now you know you're positive. So on the next slide, so Alexis, let's use her as an example, maybe had that sore throat, but now she got tested and she knows she's positive. A person with symptoms in America today and in many parts of the world can actually get treatments. It can directly benefit her right now. But more, the person who tests positive and knows they're positive, they can stop seeing other people. They themselves can protect others. So together, this is how See and Notify contributes to the other parts of the public health intervention. Next slide. So just to set us up, this is where we are today. This is the data we know. It's limited, and it's limited on purpose for privacy, but the rest of our speakers will tell us how we got here and what meaning to take from that. Today we have, as you've heard, nearly 14 million activations. We've had about 110,000 COVID positive EN users who tested positive and used their code. And this led to over 300,000 EN page visits where people acknowledged that they'd received an EN and were likely to go on to that protective behavior. And notably, about half of the people who got an EN were able to get this through the process from symptoms to putting a code in less than 3 days.